Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Let's look at today's top news. Medical negligence complaint required doctor's opinion. IPC 304A Quashed, says High Court. In a recent judgment, the Jharkhand High Court has declared that private complaints against doctors for medical negligence cannot proceed without prima facie evidence supported by a credible opinion from another doctor. This ruling aligns with the legal precedent set by the Supreme Court in the cases of Jacob Matthew vs. State of Punjab and Martin F. D'Souza vs. Mohammed Ishfaq. The High Court emphasized, in view of the above two judgment of the Honorable Supreme Court, it is crystal clear that a private complaint may not be entertained unless the complainant has produced prima facie evidence in the form of credible opinion given by another doctor to support the charge of rashness or negligence on the part of the accused doctor. It appears that to allow the proceedings to continue will amount to an abuse of the process of law. The judgment came in response to a petition filed by a doctor seeking the quashing of criminal proceedings, including the order taking cognizance of the offence under Section 304A of the Indian Penal Code against him. The complainant had accused the doctor of gross medical negligence, alleging that his mother died due to the accused doctor's action while she was admitted to the Dwarka Das Jalan Memorial Hospital for weakness and difficulty in urination in 2011. The High Court's ruling underscored the necessity for a substantiated medical opinion in claims of medical negligence, reinforcing the need for evidence-based accusations to prevent misuse of legal provisions against medical practitioners. BHU doctors successfully removed 25 paise coin stuck in man's trachea for 8 years. Doctors at Sri Sundarlal Hospital, BHU, recently performed a rare and successful surgery to remove a 25 paise coin lodged in a 40-year-old man's trachea for the past 8 years. The surgical team, led by cardiothoracic surgeon Professor Siddharth Lakhotia and Professor S.K. Mathur, completed the 20-minute procedure on Tuesday. Dr. Lakhotia noted the unusual nature of such cases in adults due to their strong cuff reflex, making this incident particularly rare and life-threatening. Dr. Amrita Rath from the Department of Anesthesiology highlighted the precision required for such procedures, where even the smallest errors could pose significant risk. The team utilized an advanced rigid bronchoscope to successfully remove the coin. Dr. Ratnesh Kumar, another cardiothoracic surgeon on the team, emphasized that this capability is unique to the Institute of Medical Sciences at BHU. Dr. Kumar also said that in case of adults, if a person sleeps with anything in their mouth or is in a semi-conscious state under the influence of alcohol and drugs, then the chances of foreign bodies entering the windpipe increases. Recently, the BHU doctor also successfully removed the key of an almirah from the trachea of a patient which was stuck in his windpipe for 10 years. First ever guidelines to help adults quit tobacco released by WHO. The World Health Organization has released its first ever guideline to help adults quit smoking, recommending a combination of digital cessation program, behavioral support, and medication. With 1 in 5 adults worldwide consuming tobacco products, the guideline aimed to address the need of the 750 million users who want to quit but have limited access to effective cessation services. The recommended treatments include counseling, habit-changing techniques, dedicated apps, nicotine replacement therapy, and medications such as varenicline, bupropion, and cysteine. WHO emphasized that the most effective approach combines behavioral support with pharmacotherapy. WHO Director General Dr. Tedros highlighted the significance of these guidelines in combating tobacco addiction and reducing tobacco-related diseases. The guidelines also advise integrating tobacco use status and cessation intervention into patients' medical record and training healthcare workers to support smoking cessation. Traditional and alternative therapies are not recommended due to insufficient evidence. While the guidelines strongly recommend varenicline, they do not address the role of e-cigarettes, acknowledging the complexity and need for further evidence. The tobacco industry promotes vape as a safer alternative, but WHO remains cautious due to the potential for misuse of its recommendations by tobacco companies. Health Ministry issues advisory to states amid rising Zika virus cases in Maharashtra. The Health Ministry has issued an advisory to all states and union territories in response to the recent detection of Zika virus cases in Maharashtra. Dr. Atul Goyal, Director General of the Health Services, emphasized the need for constant vigilance and monitoring. States are instructed to screen pregnant women for Zika virus, monitor fetal growth in infected expectant mother, and adhere to central government guidelines. Health facilities must appoint nodal officers to ensure premises are free of Aedes mosquito, which transmit the virus. Strengthening entomological surveillance and intensifying vector control activities in various locations, including residential areas, schools, and health facilities, are critical. Public awareness campaigns should be launched to educate communities about Zika, emphasizing its typical mild and asymptomatic nature, though it can cause microencephaly in fetuses, although no microencephaly cases related to Zika have been reported in India since 2016. States must also be prepared for potential outbreak and ensure the availability of necessary logistics. Detected cases should be reported to the Integrated Disease Surveillance Program and the National Center for Vector-Borne Disease Control. Zika testing facilities are available at the National Institute of Virology in Pune, the National Center for Disease Control in Delhi, and the select ICMR laboratories. Regular reviews are being conducted at higher level to manage the situation effectively. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.